Welcome. This is our health channel. I'm Dr. Justin Lin. We're shooting here in my clinic at Rehab and Biophysical Therapy in Tustin, California. Our health channel is created for us by one of us. Not too long ago was I where you're at, wondering all these different health questions, how to sift through about wellness, fitness, and injuries. All the information out there, how do you really understand what the true source is, and does it even make sense? So sit back, relax, and learn. Because after all, this is our health. Welcome, I'm Dr. Justin Lin, and this is our health channel. Today, we're going to talk about a very important topic. This is why I've got my helpful hand. We're going to talk about carpal tunnel syndrome. Now, this affects what I like to call everyone the modern day desk jockey. And anyone that has to sit at a desk, type, be on the computer, or is constantly using their hands is very susceptible for such a pathology or such a syndrome. Now, if you don't know what carpal tunnel syndrome is, a lot of people can mix it up with arthritis, they can mix it up with tendinitis of the wrist muscles. So I just want to clarify what that is. A lot of the times it accompanies numbness and tingling, pins and needles, down to your hands, your fingertips. Sometimes if depending on which nerve is entrapped or impinged, sometimes it's just like these first 2-3 fingers, and sometimes it's these outer 2-3 fingers as well. And that just depends where it's getting compressed here. Now, just the sheer biomechanics, if we go over it via my side here, if you're on a setting or on a desk that's not really conducive for you, you're already putting pressure on that area, which if you're doing that, you just feel, I always tell people it's like pressing your fingernail. A lot of blood, lack of circulation goes through here. So that kind of makes sense. If you're doing that for 8-10 hours a day, you're very susceptible for a lot of lack of circulation, the lack of nutrients going into the hand, and also the lack of toxins or wastes that are being pulled out. We have very important veins, lymph nodes that really go to our hands, and it's highly sensitive and it's highly innervated in our body in what we call the homunculus, which is the sensory part of our brain. So we really want to constantly be attentive to a couple things here, and this is where I want to get into. We want to get into posture, because a lot of the times there's something called the double crush syndrome. And so something is being pinched up here in the neck, and then also you're compressing and pinching something here in your hand. Now that's the risk. I like to tell people it's kind of like running a water hose. And if you've got a long hose and no crinks or little dents inside the hose, the water's output's going to be good. And our neuro input and output has to be just as good. It has to be quick. And so if it's pinched or something going on in the neck, and it's also pinched here, then you can see it's like having two dents inside the hose, and you're not going to get that much output. And that's going to start giving your body some attention. It's going to tell you, it's going to start giving you those pins and needles syndrome or symptoms, and that's when you're really going to start running into trouble. At some point, it's going to become numb. And when it becomes numb, this is a very bad thing. You know, where it comes from, you know, a lot of people are actually trying to cut and break up the fascia, or what we call the retinaculum. And in theory, that's just treating the symptoms. I'm sorry, it's got a high failure rate. And so you actually have to work on changing the biomechanics and the body mechanics and your posture. That's the solution. That's the true solution, is actually to give space up here in the neck. Now I'm going to show you right here all these veins that come out, and what this forms is the brachial plexus, really important, and that goes down to our hands and gives us a lot of referrals to our and motor control to our hand and our forearms and our upper arm. So we need to keep this healthy first and foremost. So what actually accompanies most desk jockeys is this forward head. And if you watch this forward head, it's like taking these two segments and you're shearing it forward. And what gets compromised? Oftentimes it's this nerve, which is part of your brachial plexus. And so we really want to be cautious and get the right help, get this attended to, get your active body to be able to handle something static. Our bodies are made to be active, but if you're constantly static and you're getting loaded by gravity constantly, then we run into all these problems. These discs get compressed, you have this shearing mechanism, and then you have this pressure right here that you're going to keep irritating these nerves. No wonder most of our population at some point feels some sort of wrist or forearm or tennis elbow pathology, and even sometimes that early tennis elbow feeling if you're active and you're at a desk most of the time and you're just a weekend warrior, you feel that. That's actually the beginning of some nerve degeneration, nerve impingement. I've got many patients coming in to get this addressed, and I often find that they have lots of nerve tension, and we really need to calm that down by, like I said, addressing posture, number one. You want to keep that inflammation down because our nerve can only handle so much pressure. If you've got swelling surrounding the nerve, it's pressing on the nerve as well. So you want to decrease anything you can, decrease the chronic inflammation. A lot of times cherry juice, concentrated cherry juice is out there to reduce that and to be a natural anti-inflammatory. It's also great for gout. So that's another way to really get at it. But I would recommend going to your physical therapist, getting your posture addressed, getting the right exercises to get those shoulder blades back and your neck back, and then getting the hands corrected at that point. This is secondary compared to what's up here, and that's the primary issue. It's actually getting at this. And most of the time, people that get this 10 to 15 years later, they're getting a repair here in their neck. And that's because this was the initial symptom of what was going on up here in the neck. So remember to get that checked out. And this is the best way to get after this, to kind of, to avoid surgery, to get the anti-inflammation, and really get this nipped and taken care of as quickly as possible. This is Dr. Justin Lin. This is our health channel. Just remember, this is your health, this is my health, and this is our health. Thank you very much.